Advocacy, both at the district and the national level, where the hospital picture has been portrayed. The actual hospital, picture, the fact that we didn't have water, the fact that we didn't have mattresses, the fact that we didn't have staffing. I can boast now of an additional, I think, 5 midwives. We have now water to maternity and theatre.
The results in Shema did not come easy. In Kigarama Health Center, through the advocacy by Epilepsy Support Association Uganda, traditional birth attendant who had been conducting illegal abortions and letting mothers die and subsequently burying them in her courtyard was arrested.
There was a woman who died due to overbleeding. This woman was by the name of Nwagaba Mase. She had delivered and overbled and died. So the woman, Manjeri, the old woman, had to conduct us around as police and LOCs. LOCs included the area LOC3. Moved around and got many graves around, kind of graveyard, various sizes of fetuses, fresh and decomposed ones. So we picked the woman, we charged her. As per now, she has appeared for charges of murder.
Despite the fact that there has been significant progress in as far as maternal health is concerned, a lot need to be done in order that the underlying factors of reducing maternal mortality are realized. As this woman delivers here at the health center, one cannot fail to recognize the inconsistencies due to a lack of basic services like water and cloth.
Water is the problem. When we don't have water, and the maternity deals with water, if there's no water, everything is different. So when we have a high number of deliveries in the labor suite, we don't have tap water. The borehole is, I don't know how many kilometers down those ends is where the borehole is. Sometimes we resort to this tank water, and when there is no rain, it is not there. You have to stand in the labor suite, wait for water. You send the attendants to go and collect for you water to clean the labor suite after conducting a delivery, or water for diluting jig, soap for cleaning the labor suite.
In all 8 districts of implementation, the minimum requirements are not fully met. In Mubende district, particularly Chiganda Health Center 4, Dr. Jude Kiza has beaten all odds to be able to make a difference in a meager resource environment.
When a mother sees that a health facility is having a theatre which is functional, they gain confidence within that center.
Another functioning theatre is found in Oyam district, operating over 10 patients per day. In bid to replicate what is happening in the 2 districts, Epilepsy Support Association Uganda advocated for another theatre at Shuku Health Center 4. However, the challenges of basic utilities like blood render the facility non-functional.
We would be having a very big increase in the deliveries, but we shall find that that one is being hampered by the failure to recruit a medical officer for Shuku Health Center 4, because most medical officers have shunned rural health center force. Though the government has tried to increase 2.5 million per month, as a token, see how health center force can be functional, but few medical officers have taken over the rural health center force like Shuku. Though there is a theater and there is a doctor's house, in the last recruitment, we failed to recruit a medical officer for Shuku Health Center 4.
Despite the theatre's non-functionality, hail to the health unit management team at Shuku Health Center 4 for being able to exercise their rights to claim for a functional referral system where they were able to receive an ambulance.
Well, you see, the heresy management committee has always been safe with the existence of the heresy unit. So we have added on what others had done. Where we asked for ambulance and we obtained it. I was the chairman of the committee at the time when we asked the minister. It was by saying Dr. Nduhura to get us ambulance, and we got it.
The implementing partners under the coalition Voices for Health Rights, Uganda National Health Consumers Organization, Maternal Health Uganda, Epilepsy Support Association Uganda, Sickle Cell Association Uganda, Theta, Joyce Facility Center, Reproductive Health Uganda, Health Action Group, and Action Group for Health, Human Rights and HIV have done a recommendable job. But a lot still need to be done. The debilitating condition in which midwives deliver using their mobile phones, staff housing, poor impassable roads, lack for referral systems, among others, still remain a hurdle towards sustainable and improved maternal health care.
We have young organizations that are looking at the issues in the sector, the neglected diseases including infertility, mental health, epilepsy, sickle cell, and we think that these are issues that tend to be neglected. So bringing these young organizations on board and being able to support them to develop systems, and we've had the Swedish Embassy through RFSU support these organizations to be able to develop systems and the management support, and we think that this has been very good for us as local NGOs, but also for the sector, that you have different civil society organizations that are coming together and building capacity and working together as a team to promote care for even those very neglected diseases.
The successes, however, need not to end in a few sub-counties in the 8 implementing districts, but rather the best practices to be replicated as a standard model throughout the district and eventually in the country.